student nurse today. How are you doing?
I'm great, thanks.
Okay. All right, let me go ahead and close this for some privacy and do some hand hygiene. Can I get you to state your name and date of birth, please?
George Washington, July 4th, 1776.
Okay. Can I check your arm in? Fantastic. Okay. And I'm just going to check the orders. So it looks like today we're just going to be doing a physical assessment. So I'm going to begin. Is that all right with you?
That's good.
Okay. So I'm going to start with your head. Just do a kind of assessment of your head. Patient's head appears to be symmetrical. I don't notice any swelling. Do not notice any voluntary movements on the face, and the hair coloration, it appears to be normal throughout and consistent. Do you ever get migraines?
Nope.
Nope. Okay. And so now we're going to move to the ears. The ears appear to be symmetrical to one another. The shape, the size, and the color are consistent. And on the external part of the ear, do not notice any swelling. Do you wear hearing aids?
No.
No. Okay. All right. So I'm going to move to the assessment of your eyes. You can just kind of look at me. I'm going to get an idea of your pupil size. So pupil size is 4. I'm going to use the PERLA acronym, which stands for pupils equal, round, reactive to light, and accommodation. So patients' pupils they're round, they are equal, and now we're going to check for I'm going to check for light, pupillary light response. And to do that, I'm going to shine this light I'm going to start with your right eye and just move it in and away. And I should get a direct response from your right eye, which is 100% constriction. And from your left eye, I should get a consensual response, which is about 50%. And then I'll do the other eye. Is that okay with you? Okay. All right. Sorry. Okay, so I did note that the constriction was direct constriction, and then a consensual restriction. So now I'm going to check for accommodation. So what I'm going to have you do is I'd like for you to look at that picture on the refrigerator for me. And then I'm going to put this in your line of vision in a minute, and I'm going to ask you to focus on that, and then turn your focus back to the thing in the distance. Okay?
Okay.
All right, so focus on that, and then can I get you to focus on this? Okay, now focus on the picture. Okay, so I was able to see by accommodation that the pupils dilated as he was looking in the distance and constricted as he was looking at the item closer to his eyes. Okay, so have you ever had any eye surgeries, any LASIK or anything like that?
No.
Okay, all right. So now I'm going to move to your nose. So the patient's nose appears to be, the structure is even, the coloration is consistent, and now I'm going to have you test for your nostril patency. So I'm just going to have you put your finger over one nostril and breathe out. Okay, now do it with the other nostril, please. Fantastic. Did you have any difficulty with that?
No.
Okay, all right. Do you get any seasonal allergies or anything like that?
No.
Okay, all right. So now I'm going to look at your mouth, throat, and neck. So patient's lips appear to be, they're symmetrical, they are moist, and their color is consistent. Maybe you just clench your teeth slightly. Okay? So patient's teeth appear, they're white, they're shiny, and don't notice any issues with the gum line of recession or bleeding. And I'm going to get you to just open your mouth wide for me. Okay. So oral mucosa is it is smooth, it's shiny, and it's moist and pink. And so look at the patient's neck appears to be trachea is midline, and the contour is normal. I don't see any swelling. is smooth. So now while you're sitting there, I'm going to go ahead and check for jugular vein distension. So in a hospital setting, patient would be at a 45-degree angle. We'll just pretend here. So if you'll just look to the right for me. Fantastic. And then I'm going to move to this side. Can you look to the left? Okay, no dissension is noted. Perfect. So, next we're gonna move into to the neurological part of the assessment. So for this, I'm gonna ask you a few questions to assess your orientation. So can you tell me what your name is?
George Washington.
Okay. Can you tell me where you are currently?
I am in the United States.
Okay. Can you tell me what year it is currently?
It's 2022.
Okay. And can you tell me what you're doing here?
I'm here to get a physical assessment.
Perfect. Okay, so patient is oriented to their person, place, and time. Great job. And now I'm going to tell you a little bit about it's the Glasgow Coma Scale. It is something that we do to assess patients who come in that have had a trauma to test their level of consciousness. So patient would come in, we would use the scale anything from a 13 to a 15. There's 3 responses that we look at to test them. It would be an eye-opening response, a motor response, and a verbal response. And from that, we would get a number. 13 to 15 is within the normal range, and that means either mild or no brain damage. And anything 8 or below would be a severe case of, it would be severe. So, do you have any questions about that? Okay. Perfect. So now we're going to move into respiratory and cardiac assessment. So, are you having any shortness of breath or any trouble breathing?
Nope.
Nope. Okay. Do you have any chest pain? No. What about have you had any coughing or congestion recently? No. Okay. So that's great that you're not having any coughing. I do want to tell you about a technique and a device that we have that can help if you do have congestion. So there's a technique. If you're in a bed, it's turn, cough, and deep breath. So you can, if you're on your right side, you would flip to your left side, and you do that every 2 hours. And as you're turning, you would turn and you would cough and take a deep breath and cough. And that's just gonna expand your lungs. It's gonna help expel any mucus. And you can also use, this is the incentive spirometer that we have. It's a device we can use. And so what you would do is you just put your mouth over the mouthpiece and take in a really deep breath, and you'd hold it for 2 to 5 seconds, and then you're just gonna slowly exhale, and you would do that 10 times an hour and space it out over the full hour. So how many times an hour would you do it?
10.
10 times. Okay, perfect. And so now I'm gonna go ahead and I'm gonna listen to your breathing, and then so every time that the stethoscope touches your skin, if you'll just take in a deep breath for me, please. Okay. All right. And go around to your back, if you don't mind. All right. Very good. If you'll just put this arm across your chest for me.
Yeah.
All right. Take a deep breath for me. One more. Okay. Then if you'll put this arm across your chest. Deep breath. I'm going to go ahead and listen to your heart. You can just relax. So I'm going to start in the aortic area. Then I'm going to move over to the pulmonic. Move down to the Erb's point. To the tricuspid. And then the mitral. All right, very good. All right, breathing was clear, normal pattern, and rate and rhythm of the heart was good. Also, I did vitals before the video, and patient's respirations were 14 breaths per minute, and he appears to continue to have normal depth, regular pattern of breathing. So, good. So let's see. Now we're going to move into the musculoskeletal part of the assessment. So, are you having any specific pain in any upper or lower extremities?
No.
No? Okay. All right. So we're gonna test your range of motion. I'm gonna do your wrist and your fingers and your knee and your ankles. Actually, before we move to that, I'm sorry, I did forget to, let me check, I'm gonna do a few other checks. I'm gonna check both of your pulses, your radial pulse. Violet, I'm gonna test both. All right, both are +2. Can I get you to do that for me? I'm gonna test your capillary refill. This is to test for any blood flow issues. Refill should be less than 3 seconds. Very good. All right, and I'm gonna go ahead and check for edema in your arms. Very good. And then I'm gonna check the your pulse in your foot and the dorsalis pedis. Very good. I'm gonna do both are +2, and then the posterior tibial. So there's both about a 1. And let me check for edema. No edema is noted. All right. And so now we're going to do the range of motion. So for your wrist, I'm going to have you do a few different motions, and I'm going to kind of hold your wrist right here to feel for any cracking or feel any sensations. So I'm going to have you flex downward as flexion, and then go back to a resting position. This is extension. And then if you'll do your wrist up, that is hyperextension. Okay. And while I have you here, I'm gonna go ahead and just test your, if you push up against my hand, I'm sorry. All right, and then go down to the flexion and just push against my, perfect. Okay. All right, so now we're gonna test both, I'm gonna do both wrists. So if you'll go to the flexion position, please. Perfect, and then go back to resting extension, okay, and then up to hyperextension. Perfect. All right, okay. So I'm gonna go ahead, if you'll to the flexion, I'm just gonna push against my hand, perfect, and then up to the hyperextension and push. Good job. Okay, great. So now I'm gonna do the same thing with your fingers. I'm gonna kind of hold you right here to kind of feel this area. If you'll just bring them down, flexion. All right, and then just back up to extension, perfect. And then I'm gonna do this hand as well. All right, if you'll go down to flexion, perfect, and then just back up to extension, perfect. So I'm just gonna hold your hands kind of like this, and if you'll just push against my fingers. Okay, great job. All right, and now I'm gonna check your knee. So I'm gonna kind of you're gonna flex your knee back, and I'm just gonna hold right here. So go ahead. Okay, and then extend it all the way. Perfect. Did hear a little crack there? Okay, so we're gonna do the same thing on this knee, please. Okay, and then if you'll extend it, way. Okay. All right. And then, well, I'm gonna go ahead and, yeah, if you'll push against my hand, okay, and then in the flex back position as well. Good job. Okay, I'm gonna do this one. If you'll extend, push again, perfect. And then the flexion. Good job. Okay, so the last thing that we're gonna do is just test your gait and your balance. So if you would stand up for me, and just come stand right here for me, and just walk to the door and back for me. Okay. All right. And this time we're gonna do a heel to toe, just like this, just for a few feet, and I'll kind of walk beside you just in case. Okay. All right. I think that's good enough. Good job. You can turn around. Perfect. All right. You can go back and have a seat. So patients' gait and balance are good in a normal range. Do you have any questions for me?
No.
Okay. All right. Well, thank you very much.
Thank you.